Okay, we're here, we're live, it's Thursday. Whoa. And it's Thursday at noon. That means it's Aloha United we stand, standing with Aloha United. And there are so many great charities, great nonprofits that are supported by Aloha United. We'd love to talk to them. They form the social safety net and much more in our community. They are critical to our community, and we are learning so much by talking to them. Today we're going to talk to Lisa Kimura. She's with Healthy Mothers and Healthy Babies. Very curious to know exactly what they do. Welcome to the show, Lisa.
Thanks for having me.
Yeah, great. Okay, so we're going to call this show, of course, Aloha United we stand, but more specifically, Healthy Generations, which takes, it takes a little further than mothers and babies. It means there will be a next mother and a next baby down the road.
That's right. I mean, there's 19,000 babies a year born in Hawaii. Every single year we've got 19,000 more babies born. So there's a lot of people to take care of. There's a lot of things to know. And then you're right that healthy starts are important for not only this generation, but for every generation to come.
Okay, so give me the definition then of the organization. You're going to help healthy mothers. You're going to make mothers healthy who have had babies in the recent past, and you're going to make those babies healthy.
Right.
And what's, of course, it starts with what, pregnancy? Is that right?
It actually starts earlier than that, really.
Okay,
so,
go.
Yeah, so actually there's a term called the first 1,000 days, and that's the year...
I thought that was in the presidential elections.
That might be too, but this is a lot more fun.
Interesting comparison, though.
Yes. So the year prior to conception, the 9 months of pregnancy, and then the first year of baby's life. That 1,000 days or so is the really critical period that we're trying to address.
That's 3 years plus.
Essentially, yeah.
Yeah, I misspoke about the president. He gets 100 days, not 1,000.
There you go. That's right.
Okay.
That's right.
But the 3 years plus, so, you can see a lot happening in 3 years plus. I mean, really, the individual is already in some ways formed by that time. So it's critical period.
Yeah, well, and the important thing is we want moms getting healthy and getting their bodies healthy before they're even thinking about pregnancy. Yeah. So that means making healthy choices for themselves, healthy diet, getting chronic diseases under control, like
no
diabetes,
smoking, no drugs.
Drinking is
none
a problem.
None of that stuff.
Yes.
Yeah, all the bad stuff out.
Right.
So it's hard to convince them, though, because sometimes they're habituated. Am I right?
Well, that can be the case. That's right. And half of pregnancies are unintended. So people aren't necessarily thinking about getting pregnant and might be making choices that aren't the best for themselves and certainly aren't the best for their baby to be.
You take any position on termination of pregnancies?
We're here to support women in any decision that they need to make. So if that means
you don't take a position one way or the other?
We take a position of health. And so we want to do what's best for moms and babies, and we don't advocate necessarily for a termination, no.
Okay, but you don't advocate against termination either?
No, we support health services that are accessible when people need them.
Okay, that's a fine line to walk these days,
It can be, but I also feel like it's misunderstood. So, for example, a lot of people get upset about family planning clinics that might offer services. But the important thing to remember is that there's so many more things that they're offering that's preventing the unintended pregnancies. Yeah. And when we have women that have access to timely information, access to contraception, then we don't have so many of these babies that are born that are not really, they're not intended pregnancies.
The 1,000 days, what? I don't think I understood. It starts with birth, or it starts before birth?
We start a year prior.
1 year prior, that's 365 days.
A year prior to conception.
Conception. Okay, so that's plus 9 months, a life and being, as it were.
Right.
And then, so if you add that up, 1 year plus 9 months, then you have another roughly 2 years of coverage, so to speak, before you get to 1,000 days.
Right. So so we want to take care of women throughout that whole spectrum, and we want to make sure that not only the women, but if she has other support in her life that she needs, for example, her partner or her parents or something that need education or know how to support her or know how to make the best decisions to support this life, then that's what we want people to have access for.
Where do you do this? You do it at the home? You do it in your office or clinic somewhere?
So we do a variety of things. One, we partner with health clinics, and we offer support to them in the way that we can provide, for example, our Text for Baby program, our Mother's Care Line, a variety of things.
We're going to have to talk about
We will talk more about that, yes, yes. But we partner with the clinics to identify clients that they have
Yeah.
that may need help. So they refer them to us for programs. We also do stuff within our office setting where we have a Becoming a Mother series, which is designed to get moms and their partners engaged in the process. So not being afraid of becoming a parent, getting really excited about
Classes.
it. Yeah,
Training,
classes.
yeah.
And it's not a training per se, it's more of a workshop setting.
Okay, where's your office?
We're located at the Waikiki Community Center.
Okay, okay.
Yeah.
Wow, that's a big space. You use the whole space. When you are operating, in counseling or what do you call it again?
Offering workshops or services.
Workshops, yeah. You use the whole place?
We have an office there, so there's a lot of different rooms
Okay,
there. Yeah.
okay. And what economic groups do you handle? I mean, you all across the board, are you only for disadvantaged? Do you handle the homeless? That's a multiple compound question for which
Yes,
I
it
am
is.
famous. So see what you can do with it.
All right, let me take that apart for you then. So ideally, we're focused primarily on the really high-risk, low-income women. These are the people that have the poorest birth outcomes, higher
What does that mean, birth outcomes?
Preterm births are more common.
Not healthy birth.
Not healthy births, time in the NICU. They may have higher infant and maternal mortality rates. So
This could be the effect of drugs, huh?
it can be. It can be effect of stress. It can be the effects of poverty. It can be effects of poor nutrition.
Yeah, yeah.
So ultimately, it's a very comprehensive look at what needs to be happening for the health of the mother.
Okay.
And again, basics like nutrition. We need to make sure that people are eating well and taking care of their bodies, because when you come into a pregnancy when you're not healthy, the outcomes are not so good.
And if you are poor, you're less likely to know about and engage in good nutrition.
Right.
Okay, so we got people who are economically disadvantaged, and are they married or unmarried? Are they with the other half or alone when you get involved with them?
It's a variety.
Yeah.
Yeah, it always depends. And it doesn't really matter to us one way or the other.
No?
Yeah.
No.
So
Okay.
we're just here to serve.
And are they in good physical condition, good health condition when you first have contact with them, or are a notable percentage of them already in health issues?
Well, the interesting thing is the Department of Health statistics kind of also mirror what we find, which tends to be that lower income individuals oftentimes may not have had health insurance before, so they're not getting regular care, so their whole just things are not going so well for them.
Yeah, so that means that your intervention has to be a little more
Timely.
aggressive.
You're right,
to
and that's
catch
why,
everything.
again, we're trying to reach people before they're even thinking about pregnancy.
Yeah.
That even starts from teenagers, high school age, so knowing about how to have healthy choices in
What
life.
about high school kids? There's thousands of them, hundreds of thousands of high school kids. And they're all, at risk. I mean, it's high school kids. What do they do with their part, So how do you reach all those kids? How do you have an effect on healthy babies, healthy mothers with those kids?
Well, the great thing is we have so many partnerships, and so our organization has been around for over 20 years, so we're well trusted. We're very deeply partnered within the.
But how do you pick the ones you want to talk to?
The great thing is there are programs out there. So, for example, there's teen mother programs at some of the high schools, so we partner with them. For example, Maui High School, we go over there and we do classes for them on safe sleep for their moms, because sleep-related deaths are the #1 cause of accidental death.
What kind of sex?
Sleep-related deaths.
Sleep. You said sleep-related deaths for the children.
For the infants.
Sure. What do they call it? Infant syndrome.
It's called SIDS, but that
Yeah.
only represents a small number of the number of sleep-related
There
deaths.
are other sleep-related ways for a child to die.
Yes, and surprisingly, people don't realize what a risk it actually is. So having your baby sleep with you, pillows and blankets, other people in the bed, smoking actually is a huge, huge risk factor for.
How does that work? That's with you in the bed means you roll over and crush the child?
That happens, yes.
That is very sad.
It is very sad.
Yeah.
And that's why we want people to be aware. Sometimes it happens when they're under the influence. Sometimes they may be taking medications that make them drowsy or not able to wake up. But it's all unfortunate. And so we want babies to be safe.
So you encourage them to put them in a crib.
We do. We have a program called Cribs for Kids. And the nice thing about it is it's a pack and play crib that we give along with the education. So they can have the baby right next to them in this bassinet, so they can hear them, they can touch them, they can make sure that everything is
Great.
going great.
It's interesting. I think people probably see it as very organic to sleep with a child. It's a almost romantic notion, and yet it's dangerous, if not fatally dangerous.
It is. And we don't want to be the kinds of people that are standing between the nurturance that
Yeah.
parents have with their babies. And that's not what it's about. It really is about the fact that it is a significant issue and it's not well understood. For example, SIDS is a very mysterious disease. We don't necessarily know why these babies are
You
dying.
stop breathing.
They just stop
For
breathing.
no reason, no
Yeah.
apparent reason.
Yes.
Do you have any idea what the reasons might be?
There's a lot of theories. And
Yeah,
so
give me a
it's,
theory.
well, there's some theories about inner ear, there's theories about underdeveloped breathing mechanisms, that the brain is not fully developed enough, so it's not.
But it's not environmental, though. It's not like something happened that
SIDS is not. But what are environmental factors are the suffocation deaths, the asphyxiation deaths,
Yeah.
you know, having cords from the blinds that are next to the bed, the babies get wrapped in them.
Gee whiz. And
Yeah.
smoking, you mentioned.
Smoking is a
What happens? The
huge-
bed catches on fire? Is that what it is?
It can, but more so, actually, there's a 50% increased risk of SIDS among households that are smoking.
Because of the smoke. So then it is environmental. You
That
can
is,
actually
yes.
create SIDS if you work at it.
If you tried, yeah.
Oh, ugly.
Yeah,
Yeah. And what about homeless mothers? Do you cover homeless? I mean, let me say that nearly every single organization that I've interviewed in the course of the Aloha United We Stand has been somehow involved in it because homeless is so compelling.
Yes.
Because there's so little protection, so much vulnerability, and it touches your heart. And everybody involved in charitable work, social safety net work, is there because it touches their heart.
Right.
So when you present to them the possibility of helping somebody is homeless, well, they go to that immediately in its first priority.
Right.
How is it with you, Lisa?
So with us, we will refer people into services. So we know that there are people and organizations that are better equipped to do those direct outreach services and to house them, which
Yeah.
are critically important.
Yeah.
So we want essentially to make sure that women know that our Mother's Care line is available. They can call and they can get connected to what they need, whether it's food, whether it's housing, whether it's medical service, whatever it might be. We kind of serve as that convener and that connector for resources.
Yeah, great, okay. And in that way, actually, you have a specialization of labor, and it's probably more efficient than if everybody tries doing all the same things.
Right,
Yeah.
right.
I
Yeah,
like that. That's
Yeah,
okay.
we try to stay really closely tied to what's going on in the community. So
Yeah.
we are a part of many different collaboratives, public-private partnerships, so that we know what's happening, so that we can make those referrals and in a timely way. Because nothing's more frustrating when you're trying to get help than calling around and calling around and calling around and getting dead ends. So if you can call and reach somebody.
Save a lot of time, a lot of
Effort and
down the wrong
energy,
trail,
yeah.
yeah. So after this break that's coming up, do you feel it? Do you feel the break coming? I feel the break coming.
You need a break?
Yeah. After this break coming up, I want to talk about what you need to know to operate this thing, what your people need to know, and the level of expertise, the level of commitment you need to pull it off at Healthy Mothers, Healthy Child, okay? We'll be right back, I promise, yeah.
Aloha, I'm Kili'i Akina, president of the Grassroot Institute and host on Ehana Kako, a weekly program on the ThinkTech Hawaii broadcast network. Ehana Kako means let's work together. Think of the sad alternative, let's not work together. Here in Hawaii, with all of our diversity and the richness of the people, it's important for us to come together around issues on the basis of what's right, and what's good, and what's going to serve the common good. And that's what we try to do at Ehana Kako. Every week, we interview movers and shakers, people in government, business, and other sectors of society to talk about how to create together a better government, economy, a better world here in Hawaii that can bless the rest of the world. I thank you for your attention to ThinkTech Hawaii, and we look forward to seeing you every Monday, 2 to 3 p.m. on the ThinkTech Hawaii Broadcast Network. We're Ehana Kako, and we wish you well. Aloha.
Okay, we're back, we're live. What a day, Thursday. Okay, and we have Lisa Kimura, who is with Health Mothers and Healthy Babies. And here in Aloha United We Stand, we're talking about healthy generations when you put it all together. So, I always admire people in the charitable organization. We're charitable, we're 501c3 too. We don't do that sort of hands-on thing you do, but we are also guided by concern for the community. And this will be helpful for you. It's called Mahayana. Mahayana, an old Buddhist word, it means concern for the community, for the greater good. Yeah. And you have to be motivated by that. So
Yes.
what's your background, Lisa?
So for me, I've kind of segued back and forth between the nonprofit and for-profit world. But ultimately, after I had my second child, I have 3 now, I realized that my heart is really in the service to moms and babies. And I really made a choice at that time that I wanted to pursue that direction, just because I knew what I had been through, and I knew that the resources that are available, how much they matter when you need them, just made me make that choice. And so I didn't look back, and it's been about 3 years I've been in this role now, and it really is the best thing I could have ever done.
Really?
Yeah.
Good.
I'm
So you'll
so
be with
happy.
it for a career then?
I will be. I'll always be, I think, working with moms and babies, because my passion is making sure that not only do you have a healthy start, but just a healthy connection, and growing together as mom and child, enjoying that relationship. It's really, when you have that, it's the really best thing you could have.
It's the finest thing you could have in
Yeah.
the world. You're connecting the generations is what
Exactly.
you're doing.
Exactly. And then your kids grow up and become good parents and have more babies that they love and take care of. So
Now, how much of your own baby giving, baby experience entered into that decision?
a lot, really.
Okay.
Yeah. I mean, so I actually used to work at Aloha United Way, and back then
Was that right?
Yeah,
Okay,
and I
okay.
was in a lot of early childhood programs then.
Okay.
And I loved it. And this was actually before I had kids. And I thought it was just so interesting. And it was based on how parents can do everyday things to engage their young child's brain and help them grow and learn, doing normal stuff that you just do. So you're folding socks, and you help, they find the patterns, or they find the colors that match.
Oh,
Or
that's lovely to watch
Yeah.
that kind of thing.
Exactly. And it's just so basic. And when you know to do those things, it's learning all the time.
Watch them learn. It's very gratifying.
Yeah.
So are you a psychologist?
I'm not. I actually
what
have
did you study? International arbitrage, I know.
I have actually a communications and business background. And
It shows.
Oh, well, I hope that's a good thing.
It
but
is.
but then around the time I had my second, when I was pregnant with him, I took a parent coaching certification postgraduate course.
Yeah.
And because at that time I was really thinking about it and how we could just do things differently and better for kids as parents. And then that just sort of really ignited my fire, and I just decided that's what I need to do.
So has it been as good as you expected it would be?
Yeah, it is.
Has it been better?
It's been better.
Yeah, how?
Meeting people and talking to them and realizing that, we're a small organization, so we're pretty nimble, and we can test things, we can pilot things, we can explore, we write grants for things, we see the needs, and we just go for it. So breastfeeding legislation, which was supporting moms in the workplace, we helped work on that. It passed, and then
Does that happen?
yeah, so
Well,
moms
not much, though.
Well, there's always challenges. Some workplaces are great, and the ones that are more supportive of moms and families find the returns are huge.
Huge, yeah, because everybody likes it when it happens.
Yes, moms are there.
Oh, wait, there we go, but that's not the workplace, or is
No,
it?
but the idea is that if we can keep moms breastfeeding, they're healthier. They're actually lowering their own breast cancer rates, their
Interesting.
osteoporosis rates.
It's because the natural process,
It's entirely natural. It even helps shrink the uterus back to its normal size after birth. So it's amazing.
So God knew what he was doing when he put this whole thing together.
Yes.
We have to go with our gut on this kind of
That's
thing.
right. We have to get back to basics, honestly.
Back to basics, yeah.
Yeah. But yeah, so the more that employers are supported, they have healthier moms, they have healthier babies, fewer sick days, better retention rates, lower healthcare rates. It's all good.
Yeah.
And other countries have figured it out, other states have figured it out, but we're getting there.
One other thing is when you were in business before you joined the Aloha United Fund, or Way Fund, whatever, what were you doing? What kind of business were you in?
It was communications, so.
Oh, okay,
Yeah,
okay.
yeah.
Here, locally,
Yeah, here
yeah.
locally, advertising.
So you really know the territory, you know the
I do.
community.
I spent my whole professional life here, so I love Hawaii. I love the people. I love the community.
Yeah,
Yeah.
okay. Now, you said it was a small organization. How small is small?
We have 5 people, and 3 of
5.
them are part-time.
And what's their training? You're the boss,
I'm the boss. Yeah.
executive director. And you have, you're a regular, nonprofit Hawaii corporation?
Yeah, 501c3.
Okay,
Yeah.
and you have a board of directors and all that stuff?
Yes.
Because Aloha United Way would not put you on Aloha United would stand unless you had corporate, infrastructure.
Right.
But anyway, so now the 5, what's their training? What do they do specifically?
Yeah, so my program people have a master's in public health, and so they're very well educated in terms of health needs. And then my other staff are support, so bookkeeping and web support, that kind of thing. Yeah.
Okay. So how many are going out into the field, training, counseling, talking to people?
There's 3 of us, so myself and my 2 program coordinators.
And the rest of the back office?
Right.
Good. That's great. What are your corporate plans? I mean, you're going to expand from 5, or you have a plan to go to 10, 20, 50, 100?
Yeah, I mean, honestly, the needs don't end, and the more we can elevate the health in the community, the more we can do the nice to have stuff, which I think is all good. But we do need to make sure that more pregnancies are intended, and so that means that, again, that people are getting access to contraception when they want it and need it, that they're coming into pregnancy healthy. So that means we're getting these chronic diseases under control.
Yeah.
So yeah, obesity, diabetes, all of heart disease, all of these things that are not good for anybody, but especially not good when you're trying to have a child.
Yeah.
And then ultimately too, just making sure that everybody's got healthcare coverage, that they're going to their appointments, because women that are not getting prenatal care, again, end up having.
That's dangerous business.
Yeah, we want to make sure
And
that
it's
they're.
unfair to the child.
Yeah. It's just not good all the way around. So we can help prevent prematurity, preterm birth, that kind of thing.
So 19,000 children are born in Hawaii every year. How many of them do you reach?
That's hard to say. We have a lot of traffic to our website, which online we have a directory that is segmented by island and by service. So if you're looking for childcare, breastfeeding support, information on immunizations, whatever it might be, you can click and find those local resources on island.
Yeah.
So we serve thousands of people that way.
So I see. So sometimes it's just a little thing, sometimes it's a big thing.
Right.
When you add them all together, it's
a lot. Exactly.
Okay,
Yeah.
I like that.
Yeah.
Now, you're up to this point, Lisa, you've been talking about, prenatal and all that, and then you would, ostensibly, you'd follow through after the birth, and you would try to make sure that the mother and the child are healthy after the birth.
Yep.
As you said, go to see doctors, go to appointments, all that, but and put them in touch with whatever services they need to raise a healthy baby in the rest of the 1,000 days. So what sort of services do you put them in touch with?
So I mentioned our Text for Baby program, and what's really cool about that is it's a text message platform. And we know that over 90% of moms, especially of childbearing age, have cell phones and
These
they text.
days, right. Yeah.
And the best way to reach moms is not by giving them brochures per se. It's not
Yes,
by.
isn't that true?
Yeah, and people don't use the phone as much anymore.
Reaching people today is different than it was 5 years ago.
It's absolutely,
Yeah.
even a year or two. Like it's
Yeah,
changing
yeah,
very
yeah,
fast.
touche,
Yeah. So, so the goal with this program, it was developed on a national level with a lot of very credible experts. So the CDC, American Academy of Pediatrics, a whole bunch of guys, not guys, people.
People, we got
professionals.
that, yeah, we're loose about that.
Anyway, very well vetted program. And so starting from the first week of pregnancy all the way up till baby turns 1, it sends text messages to the mom or dad or whoever's opted into the program.
Baby. These days, babies, read earlier, don't they? Why not? I'm kidding. Soon enough.
You know how
you'll
important
see
it is to
soon
read
enough.
to your baby, by the way, and that babies who are talked to, read to, and involved in conversation speak more, read earlier, are more ready for kindergarten. So it actually starts from before they're even babbling.
Well, with your services, or with a mother who is akamai, you can have a lot of effect on how your child turns out.
Yeah, oh yeah.
It's not just
It's not
DNA
random.
here,
Yeah.
no.
No.
And it's not luck either. You can have a positive effect on your child's whole life.
Absolutely.
And I hesitate to say, but that 1,000 days is relevant to that because a lot of it happens early on.
Yes.
Yeah.
There's even a whole field of study now called epigenetics. So it's actually looking at the genetics of the next generation.
Of course, epigenetics. Why didn't I think of asking you that? We're going to take another break. When we come back, we're going to define epigenetics. We're going to show you how it works. And we're going to show you the possibilities that it might work in healthy baby, healthy children, healthy mothers, all that. We'll be right back.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism, or some really eclectic programs too. So really, we love to see you here on our show. Thanks for joining us and thanks for supporting us.
Aloha, this is Alice Hagan from ThinkTech Hawaii Business Education Spotlight. My show is a bi-weekly show on Thursday from 3 to 4 p.m. We invite interesting people, entrepreneurs, fascinating leaders who contribute to the social economic well-being of our state. Please tune in to my show, Business Education Spotlight, ThinkTech Hawaii, bi-weekly, Thursday, 3 to 4 p.m. Aloha.
We are. And, and during the break, I heard a most remarkable revelation. Lisa loves her work. But we knew that.
You can tell, I
You can
think.
tell. Epigenetics. I like everybody who ever watches ThinkTech to know about epigenetics because it's so remarkable. It's a revelationary kind of discovery in our time. It isn't very old. The guys who work on DNA have had remarkable, insights into how DNA really works and how it connects with our lives.
Yeah.
And it's a two-way street in
It
DNA.
is. It is.
Epigenetic.
Yes.
Tell them, you can do better than me. Tell them what it is, epigenetics.
Well,
yeah?
I'm no expert, but honestly, it's the field of study that you are impacting the future genetics that you are passing down to your future children that have not even been thought of yet. So, for example, a woman's eggs, she's born with all the eggs she's ever going to have her entire life. So the things that impact her, especially in a negative way, can have a negative effect on those eggs, which are being used to have babies in the future.
And the study of the people in the Holocaust camps, what was that?
Yeah, so they studied, and the effect of the impact on these unborn children at the time, later in life, they had a lot worse outcomes. And so they attribute it to the effects on the DNA, as well as the stress in the lives of the people, because tremendous stress, and so
Yeah.
how that impacted their health before they were born.
Yeah, it was the body's response to environmental, vectors, but incorporated in one generation, in the DNA. And that's not a mutation, as we have been led to believe
Right.
by all those guys who taught us biology in high school. In fact, your DNA can and does change depending on the influences around you.
Yep.
The
Poverty,
part of-
nutrition,
all
stress,
that,
all of it, yep.
So if the mother, for example, is starving all the time, then she, in her DNA, will treat food differently. And she'll be probably heavier in order to prevent starvation, and her rate of, I forget the word, the use of the food will change, DNA-wise, genetically. And then, surprise, the children inherit that trait that was established only by their mother and did not exist in the DNA prior to her generation.
Right. Well, and again, it's why it's so important to get people access to fresh fruits and vegetables rather than processed foods. These are all things that are impacting your health every single day. So
Yeah. We don't know anything about it yet, but
it
it is a
huge
phenomenal
field.
possibility.
That's right.
Yeah.
That's right.
So good things, bad things. Good, like fresh fruits and vegetables could teach your body to be healthier, and you can pass them along. So
Yeah.
the good news is you can have not only a training effect on your kid, you can have a genetic effect
Yeah.
on your kid.
Yep.
That
And
is the
establishing
holy
those-
grail.
Yeah, establishing good health habits for life too. When your kids see you eating healthy, they eat healthy. When they
Yeah.
see you exercising, they exercise. They
Yeah.
learn that's a normal thing. So
Yeah.
all of these everyday things that we do really do ingrain a lifetime of habits into somebody. And I got another interesting one for you, thinking about it too. So another kind of two-way mechanism that we're learning more and more about. So the relationship between mom and baby. So it's commonly called the Mother-Baby Dyad. And so why it's
Dyad.
Dyad.
What does dyad mean?
Two together,
Got it,
like
thank
in harmony with each other.
I hope you're taking notes on it.
But what's amazing is the baby's needs are always being conveyed to the mom through breastfeeding. So baby feeds more often, tells mom she needs to make more milk, so mom makes more milk. If baby gets sick, the baby then transfers through its saliva, through the mother's skin, the need for antibodies through the milk that will help relieve the baby's symptoms. or helping.
Wow, that's a signal,
It's, yeah.
communication, it's a chemical communication.
Yes. There's even hormones that are turned on in the body that when your baby is placed skin to skin with you, it turns those hormones on, which boosts your milk production. It's again, a field that is only beginning to be studied. And we sort of got derailed a couple generations ago when artificial formula was introduced.
Yeah.
And anybody who needs to make that choice for their child, they're always making
Should
that
make
choice
that
for the
choice,
child.
for many reasons. Yeah.
Right, but the important thing is to get the correct information up front about why nothing man-made can possibly replicate what we have and what's being made free for our babies every single day.
That must be a big part of your engagement with mothers and children in the first 1,000 days, to show the mothers how to eat themselves, how to handle them, how to feed their babies or breastfeed their babies, as the case may be, and in general, how to provide the best possible environment for them. Oh, that is very interesting. So, this reminds me of Kehe High School, which had a big problem between the races of the kids in the school. And they worked it out. A Japanese principal there worked it. He was a brilliant guy. I mean, he's still there. And I met him. We interviewed him for one of our shows. And one of the things that struck me was, and I heard this from a kid at the high school, was that they brought the kids in to teach them. There were a lot of Micronesian kids and Tongan kids and Samoan kids. They brought them in to the school to teach them how to live in this country, okay? But they asked the kids to bring their parents in to teach them how to live in this country. You say, wait a minute, this is the Department of Education. It's a high school. It's not a school for the community. Yes, it is a school for the community. And that's what you're doing too.
Yeah.
You're building a school for community, because these mothers have never really known. Nobody is like, it's like they had inadequate baby training, right?
A lot have, that's right, that's right. I mean, and that's true. And for those moms who really, truly need the information the most, we want to get to them. But I will say too that things like postpartum depression affect anyone. And I would say disproportionately it does affect people that are already dealing with other issues of stress. So again, economic stress, domestic violence, any kinds of scenarios at home that are already causing a lot of stress, they do tend to have postpartum depression at a higher rate. However, it can affect anybody. And so even just talking to those moms on a very micro level, one-on-one, helping her to understand that what she's going through is very normal. Here's how to get support and help. You are definitely not alone. All of those things on that individual level are changing lives. And every time I see that, it just makes me so happy.
Now, what happens on the darker side of it when you give advice and you put the mother together with someone who can give her advice on difficult situations like abuse, and it doesn't work? I mean, you find, directly or indirectly, that she didn't take the advice, or that the abuse, for example, in this case, is continuing, and there's great risk to the mother and child. What do? Do you say, well, we already did that, or do you step in? And if you step in, how do you step in?
So what I'll say to that is, for example, we actually train healthcare providers. We facilitate trainings, and actually we have one coming up on domestic violence and how they can act as gatekeepers to see what the symptoms may be, how to intervene.
Those little telltale signs.
Right, right, how to ask the right questions, that type of thing. And because they're working with them on a much closer level, for example, seeing them at their prenatal or postpartum appointments, things like that, we're training them to be the gatekeeper so that they can identify and they can get them appropriate services. Again, because we're so small, we are not everywhere. But if we can help the community be a safety net for them for an issue like this, then we can help address it. And domestic violence is so insidious, and it's something that you can't tell someone to leave. There are so many factors. Of course, we want them to leave, but it's incredibly complex, yeah. And so it's not as simple as that a lot of times. And so we want to, again, be able to be a trusted voice that they can either ask, to get started. Who can I call? How can I get help? And we can facilitate that. Or again, train other people that are with them on a regular basis to do the same.
Let me change the facts on you. This mother, who is either prenatal or postnatal, isn't taking your advice. And it's putting the baby at risk. She's not going to the doctor. She's still doing drugs, smoking, what have you. And you are concerned. What do you do? She's not necessarily going to listen anymore. She's not your best client.
Right. And once again, a lot of times that would be the kind of client that may already be in a healthcare setting, and so they might have a different relationship already. What our role as advocates is to talk to the healthcare facilities, and what we do actually is tell them we want consistent screening during pregnancy for substance abuse use, whether it's drugs, alcohol, cigarettes, whatever it might be, and encouraging the healthcare providers to use these tools that are out there, how to use them in a sensitive way, and how to consistently keep using them so that those women are tracked. If, for example, the thing is, when women get pregnant, a lot of times that is the spark for them that makes them want to make a change. They don't want to hurt their babies, and they're not trying to, and they're not being belligerent about it.
That's intuitive. It's
Yeah.
part of a mother's
It is.
way of thinking.
They're
Protect
bigger
the baby,
than themselves.
natural, yeah.
Yeah, absolutely.
Some of them, yes, but some of them, no, too.
And substance, addiction is very deep and complicated, and it's not, most people, I think, are not out there saying, forget it, I'm just going to do it anyway.
They don't think about it, yeah.
Yeah, it's not.
It carries them away.
Right.
yeah.
And so what we want to do, again, is arm our healthcare providers with knowledge, information, resources, and how to access that information. So, for example, obstetricians that may not be screening their patients, we go to them and we talk to them about, hey, these are the tools that are available. Are you screening your patients? Are you screening them all? Are you screening them consistently? How often? Are you following back up again? Because sometimes, usually, a woman will not be truthful at first, especially if she doesn't trust the relationship that she has. So we are talking to them about how to develop those relationships, make them personal, and how to have a supportive relationship so that if they do confess that, hey, yes, I have this issue, or it's a known issue, here, we're going to get you support because we care about you, we care about your baby. We don't want people to feel alienated or isolated because that just drives them away from care.
Yeah. Now, suppose the young lady reaches 1,000 days and it isn't solved. She doesn't get it yet. She still has problems. The baby still has problems. What do you do? You're not going to just say, oh, not my territory.
Right.
What do you do?
There are a lot of resources out there, and we, again, have partnerships with many of them. So, if, for example, if we did know about somebody who was in that situation, and I can be honest and say it's not really a common thing where someone is defiant about making bad choices. But if we did know, there are resources that help women to get on track. The ultimate kind of last resort is child welfare services, and that's when they will make a plan with them. Their child may be separated from them for the protection, and they make a plan so that they can get back on track.
Well, that
and get
takes me to
reunited.
my last question, which I told you I was going to ask you. Ultimately, we're here to protect the generations, to protect the togetherness of the mother and the child, and ideally the father, the mother, and the child. And this in your thinking, because you are dedicated to it, this has a macro effect. The effect of this goes beyond the individual family and the single generation. And I'd like to know your thinking about what are the ripple effects of what you do, not only in breadth, but in depth. In other words, not only to the society we live in here in Hawaii, but in depth in the generations that follow.
Every single time that we can help people make better choices, that's a choice that their children are going to make, and so on and so on. And so when we can sort of elevate the expectations, and it's slowly happening. The expectation that we're all going to have health care and get insured, that expectation is elevating. The expectation that moms are taken care of, the expectations that babies are going to be breastfed, making that the normal choice, not an alternative choice, not the better choice, but the norm. As we progress with those things, I think that's where the depth is coming from. But the more broadly that we as people in this community care, that's, I think, the most important part. And when we know why it matters to support a mom and help her to be successful in balancing her family and her work life or whatever it might be, or being a more involved parent or a more loving participant in the process, all of those things, when we as community members value them, that's what's going to make a difference.
Yeah. And it makes a better community.
Absolutely.
She is part of us, we are part of her.
Yeah, healthier kids, healthier families, healthier society.
Yeah, not only now, but in the future. Thank you, Lisa.
Thank you.
Lisa Kimura, healthy mother, healthy baby.
Thank you.
Thank you so much. Very nice. Yeah, were you a shy kid or what?